If you're having trouble getting or maintaining an erection, you're not alone and there's help. When you're experiencing erectile dysfunction, it can feel like you're the only one going through it. You may be asking yourself questions like, does anyone else have this issue? Why do you have this problem? Is it solvable, or is it going to be like this forever? Erectile dysfunction essentially refers to either the inability to get a sufficient erection or the inability to maintain a sufficient erection for sexual intercourse, explains urologist Petar Bajic, MD. It's quite common, though there are varying degrees. Dr. Bajic addresses the most frequently asked questions about erectile dysfunction and debunks some persistent myths and misconceptions. 1. How common is erectile dysfunction? Most males experience ED at one time or another. Studies suggest that as many as 50% of men between the ages of 40 and 70 may have difficulty with erection, while 1 in 10 men deal with it for the long term. This is a condition that affects a lot of men, and it can happen at any age for a variety of reasons, Dr. Bajic says. And keep in mind that erectile dysfunction is a spectrum, not an all-or-nothing phenomenon. You may still be able to get erections, but they may be weak or short-lived. Basically, if you're bothered by a lack of sufficient rigidity, then you have erectile dysfunction, he adds. 2. Is ED just a normal part of getting older? It's common for erections to be more difficult to achieve with aging due to other medical conditions. Any health problems that affect normal erectile function can lead to erectile dysfunction, Dr. Bajic says. So, as you get older, erectile dysfunction can become more prevalent. But that doesn't mean you should just grin and bear it. Urologists are medical doctors who specialize in conditions that affect the urinary tract and reproductive system, and they can help you get to the bottom of the problem. 3. Is erectile dysfunction permanent? Erectile dysfunction is a sign of an underlying issue of some sort, and treating that issue can typically help restore most, if not all, of your sexual function. Depending on the cause of your ED, treatments may include medications, talk therapy, vacuum devices, penile injections, surgery. 4. Shouldn't I be able to get an erection whenever I want? This might have been true when you were younger, but as you get older, it's normal not to be able to get erections as often or as easily. As you age, hormonal changes and other factors, stresses of adulthood affect your arousal levels. It may take longer to achieve an erection and may require more direct stimulation and foreplay, Dr. Bajic notes. 5. Is erectile dysfunction associated with other health conditions? ED is often a sign of another medical issue. In fact, the vast majority of erectile dysfunction is actually a blood flow problem related to cardiovascular disease.